And let's see. Oh, it's Global Running Day today, guys. So for all our runners out there, happy Global Running Day. So I just signed up for my first half marathon, Dr. Goldman, and I'm kind of excited.
All right, which one are you doing?
The one in Santa Barbara.
Very cool. That's
Yeah.
great. Half marathon is a good gateway drug.
So I've heard. So I've heard. All right.
When's the date?
The date?
Yeah.
October 23rd, I believe.
Nice. It's great. A little bit of time to train.
I have time to train.
Cool.
B Pinto 2, you say you want to go, you should join us. SRLA is going to be there representing. All right, I guess we'll get started now. Hi, everyone. Welcome. My name's Carla Anguiano, and I'm the Director of Operations for Students Run LA. Dr. Goldman, do you want to introduce yourself?
Yeah, my name's Josh Goldman. I'm a sports medicine physician at UCLA. Wear a lot of different hats, but one of them is working with UCLA Athletics, where I was on the COVID task force, helping us figure out a safe way to return to sport amidst the pandemic. And I have the honor of being the medical director and advisor for Students Run LA as well, which is one of my favorite jobs.
And we're happy to have you. Thank you so much for joining us tonight. All right, guys. So as some of you know, we're going to be going over information about the COVID-19 vaccine. And you'll also have the opportunity to go ahead and enter questions on the chat box. We have Cassidy from Students Run LA as well on here, and she will be guiding you guys on the chat and the comments. So if you have questions, please feel free to ask on there, and we'll try to get to them. We'll try to get to all of them, actually, depending on our time. But Dr. Goldman, do you want to go over a little bit about the COVID-19 vaccine or vaccines?
Yeah, absolutely. So, I think we are all very familiar with COVID-19 at this point in the pandemic. I was looking up some recent stats today because one of the questions I get is, how does COVID-19 affect young people, right? We hear a lot about the elderly ending up hospitalized, really high death rates, but what's happening to young kids? And so I looked at LA County specific data tallies up to this week. 13% of all of our LA County infections were in children and adolescents 17 and under. So not an insignificant number. Also remember that we're not testing young people, especially really young people, with the same frequency. So that number is probably much higher, right? Kid gets a minor cold or maybe is asymptomatic, having no symptoms, and we don't test them. So this is 13% confirmed positives. Our 12 to 17-year-old age group, which is really our SRLA folks, made up 6% of all cases in LA County. So if we break it down into those three groups, definitely the 12 to 17 is the greatest number of infections. So 0 to 4 had 29,000, 5 to 11-year-olds had 56,000, and 12 to 17 had 70,500. So the older you get, the more likely you are to get COVID. So 70,000 doesn't seem like a lot in a big place like LA County, but it is certainly significant. Another thing I was looking at was, well, what happens to young people, right? Because before we think about vaccines, vaccine is an intervention in medicine. And I always say nothing in medicine is free. You take Tylenol, you could have a side effect. You take Advil, you could have a side effect. So every time we do something, there's a risk of a side effect, and we have to weigh that with the benefit of whatever it is we're doing. So if I just look at what is COVID doing to people, right? Because the goal of the vaccine is to reduce those COVID infections. COVID does affect young people, certainly not to the rates that we see in older people, but a couple stats. In the age group of 12 to 17-year-olds, which is the group we're talking about tonight, we had 1,606,000 total cases in the United States. That's a lot. If we look specifically at how many of those kids end up in the hospital, right? Now, so that we're talking about people who are actually getting really sick, not just minor cold. It is 53.1 children per 100,000 cases. So not a ton, but 53 per 100,000 is not insignificant. And the scary number is the number of deaths. So 127 deaths have occurred in people under 17 years old. So small number, but 127 is by no means zero, and a much higher number than we ever want to see in this age group. So
Correct.
Now we kind of know what's the downside of that vaccine. So the question is then, what's the upside of dealing with a vaccine, right? So the downside of a virus, what's the upside of the vaccine? And it is to prevent all of those infections. So we always want to be weighing those pros and cons. And we'll, as we get into questions, we can talk more about what some of those side effects are from the vaccine. The other big thing I want to talk about with this vaccine is it's been a really fast development. We call it Operation Warp Speed, and it really is for a reason. This is the fastest we've ever developed a vaccine. The world record in vaccine development prior to COVID was 4 years, which is what it took us to develop the measles vaccine. So COVID in a year is the new world record for vaccine development. And so we don't have a ton of data. You know, we'll have some questions about how long does the vaccine last? And the answer so far is at least a year, because that's how long it's been in circulation. But it may be 5 years. We'll find out in 4 more years, right? So the caution with this vaccine is it's new. It had a really fast development. We can talk more about why we were able to do that so fast. But there are still some unanswered questions, not necessarily about safety, which is the most important, but really about how long it's going to last and how will it protect us as this virus continues to change.
Awesome. That's very great information. And for those of you watching, or for those of you that came in a little late, we're going to make this available afterwards. So don't feel bad about, you know, stepping out, because we're going to make the entire recording available to you guys. But also I wanted to let you know that we have 26 different LAUSD sites that will be providing the COVID-19 vaccine for teens. And they're also going to visit via mobile 250 LAUSD schools. And Cassidy right now is going to post the link on our comments in case you want to check out exactly which schools are providing the vaccine, and also where these mobile teams will be visiting. So go ahead and wait for that there. I think she's adding it now. All right, so we're going to start with the questions. The list has grown, Dr. Goldman, since we last looked at it, but the very first question is from Lila, and Lila wants to know, how does the COVID vaccine protect you?
Okay, so vaccines are a really clever design. What we try to do with all vaccines is typically we will give you a piece of a virus or a dead virus or a really weak virus so that your body can see it, study it, and then create an immune response to it. With the COVID vaccine, specifically the mRNA vaccines, which is the one that is now approved for 12 to 17-year-olds, and that's the Pfizer vaccine, that the way that works is we're not even giving you a piece of the virus. We give you a piece of mRNA, which mRNA is like a photocopy of a blueprint. So we've got a photocopy of a blueprint of the virus. We put that in your body, specifically your shoulder muscle, and those local cells take that blueprint. They make this little fragment of virus, so not real virus, just a little piece called the spike protein. And then your body studies that spike protein, creates antibodies, which is our way of fighting off a virus, so that next time you're exposed to it in the universe, just going around town at the grocery store or wherever you may be, your body says, we see this, we recognize it, we know how to fight it off. And so that's why these mRNA vaccines are so clever, is we didn't even have to manufacture the virus. We just took the blueprint, gave it to your body, let your body manufacture it for a 24-hour period, in which case those blueprints disintegrate, and now we know how to fight this thing off. So it's a pretty slick piece of science.
That sure is. Okay, so to reiterate, we are not getting the actual virus in us when we get the vaccine.
That is correct. The mRNA vaccines are just a photocopy of a blueprint, so your body can make a little piece, but not a virus.
And then as a follow-up, Alejandra wants to know, or I'm sorry, Layla, same person, wants to know, does it guarantee us immunity from COVID?
Okay, so this is all about stats. We know how effective the vaccine is at preventing you from getting the virus compared to people without the vaccine. And we have 3 vaccines in circulation, only one of which, again, is approved for kids. So that is the Pfizer mRNA vaccine. In adults, the Pfizer mRNA vaccine is 95% effective. So Layla, not 100, 95. Interestingly, in the teenager study, so they did a second study just looking at 12 to 17, and the vaccine was 100% effective. Now, I don't believe that to be true. I believe that if they had run the study longer and had bigger numbers, it probably would have been 97, 98, 99. Nothing in medicine is 100%, but it's even better than it works in adults, which is pretty cool.
Oh, that's great to hear. All right, did you hear that, guys? It's even better in teens than in adults. I wonder if I still qualify for that. I don't know what the age, you said 12 to 17, then maybe not. All right, Alejandra wants to know what the difference between the multiple existing vaccines are. And like you just mentioned, she wants to know which one you recommend for teenagers, but like you just mentioned, Pfizer is the only one that they recommend.
Yeah, so the three vaccines are the Johnson & Johnson, the Moderna, and the Pfizer. Pfizer is the only one currently approved for teenagers. All others, you have to be 18 and older. Both of the other two vaccine companies are now doing studies in teenagers, and we hope by the end of this year that they will be available to everybody. But for now, your only option is Pfizer. The biggest difference is two of them are mRNA vaccines. So the Pfizer is 95% effective. The Moderna is 94% effective. Both of those are 2 vaccine doses. So you get 1 vaccine day 1. For the Pfizer, 3 weeks later, you get your second dose. For the Moderna, 4 weeks later, you get your second dose. And again, at the end, you're 94 and 95% covered. Those are the ones where we're giving you the photocopy of the blueprint. The Johnson & Johnson is our more traditional type of vaccine where we give you this viral fragment and it takes longer to produce. That's why it was the third one to market. It's slower to manufacture, but it's more similar to, say, the flu shot, which people get every year. The efficacy of that one, the effectiveness is 66%. So comparatively less effective than the mRNA vaccines. In terms of who should get what and why, there's lots of interesting debate in the infectious disease community around that. Conveniently for our folks, we only have one option, and it's Pfizer, and it's a very good one.
All right, so Pablo had a question that you already answered, but he wanted to know what company would be better, right? So you went over the different percentages now, so that we can go based on that. But also, Pablo, just like he mentioned, Pfizer is the only one available for our teens, so there really is no comparison, right? Yeah. Okay, and Juan is touching on a subject that you earlier talked about. He wants to know how it was possible to create a vaccine in just 1 year.
Yep, absolutely. So one, the entire world took all of our scientists and put our heads together and said, you need to solve this problem. Nobody did that for measles. All right. So we didn't have the same brain power working on measles. It's also been about 30, 40 years since we did that. So that was really helpful. But the biggest answer is really that the concept of this mRNA vaccine, which we've been using for a while in research type settings, but we haven't brought it to market. There just wasn't the perfect application for it. And this virus lends itself to this really specific type of vaccine, which is an mRNA vaccine. And not to get too deep into the weeds on the science, but we don't need to mess with the virus itself to make an mRNA vaccine. So normally they have to like culture the virus and denature it and fragment it. And that whole process, it's like growing plants, right? It just takes time for things to grow in a lab. The mRNA is just a little blueprint. And so it's really easy to replicate that blueprint very quickly. And so just the fact that we changed the way we were making vaccines allows us to make them much more quickly, which is pretty cool.
It is pretty cool. Thank you. So Victoria wants to know, and I know that you mentioned that clearly we don't have a lot of data yet, but have we seen any long-term effects? Do we know of any so far?
Mm-hmm. So the longest term effects we have are a year old from the people who started the trials a year ago and were the first ones to be vaccinated. We rolled it out en masse to the public in December. So The longest masked vaccine population we have really started getting in December. I got my first dose on December 23rd. I will never forget. 1 week after my wife, who's an oncologist, who will not let me forget that she beat me to it. We still only have 2 limbs and 1 head, and we don't get any radio frequencies that the crazy blogs are talking about. So far, so good. We know a lot about side effects of the vaccine. And if you think again about what we talked about, we're injecting this blueprint that your body makes this little protein of. That entire process takes place over 24 to 48 hours, and then it's gone. It's disintegrated, evaporated, whatever you want to call it. It's no longer in your body. And so when we look at the side effects of vaccines, side effects are very common with vaccines. The most common side effect is your arm is sore because we stuck a needle in it and we injected something in there. So like 90% of people say their arm is sore after they got a vaccine.
I'm surprised it's 100.
Yeah, I want to talk to the other 10% who are like, nope, didn't feel anything. So a side effect from the vaccine is common. The next 24 to 48 hours, then, we have the effects of our immune system reacting to the virus. So that the vaccine itself isn't doing the thing that makes us feel bad. It's our entire immune system ramping up and fighting against the virus. So I'll give you an example. When you get a fever, the infection's not giving you a fever. Your body is raising its temperature to try and cook and burn the thing that is living inside of you without cooking and burning you to death. And so it's a race to see who cooks faster. So this is all of the side effects that we feel, the fatigue, the muscle aches, the soreness, that's all a symptom of your body reacting to the vaccine. So I tell everyone who gets it, and I said, oh, I felt terrible for 24 hours. I said, that's how you know it's working. So don't fear the 24 hours of body. It's going to feel like you ran a half marathon, which lots of people in this group have done. You're going to be sore after. I literally woke up the morning after my shot and said, I feel like I ran a marathon, but I didn't run a marathon.
That doesn't inspire me to run my first half, Dr. Goldman.
Little stretching afterwards, some ice bath, you'll be great.
Actually, you can tell a lot by my face, but I was really surprised by that. So it's not the actual vaccine that gets you sick. It's the reaction of your body, of your immune system reacting to it. I had no idea that's what caused the fever. So I learned something new. Actually, I'm learning a lot new, but that's definitely one of the surprises. Nancy wants to know, and this is something that you touched on already. She wants to know how long it will last. So how long does the protection of a Pfizer vaccine last?
Yeah, so this is the question. This is when I talk about, we know a lot about the vaccine so far, but there's a lot we don't know. The 2 big questions we don't know is how long it's going to last, and will it protect against all these future variants of the virus? So in terms of how long it lasts, we know it lasts a year. We do these fancy tests where we look in people's blood who have had the vaccine to see how many antibodies they still have. And we knew that 3 months out they had a ton, and at 6 months out they had a ton, and at a year out they had a ton. So the vaccine is continuing to be effective via these antibodies, like our immune system memory, a year out. For every virus, this varies. So if you think of, or every infection, so you think of tetanus, you get a tetanus booster once every 10 years. You get a shingles booster once in your life when you're 55. So it kind of depends, and we don't know if this is going to be an every 5 years vaccine, twice in your life vaccine. So how long it lasts is to be determined. The other big question, which is very similar to the flu, is what about these variants? So if you guys think way back to the years when we were talking about H1N1 and H2N3 and all these different types of flu, those are variants of the flu. So every year, influenza circles the globe, infects millions of people, and as it does so, it mutates. And so every year we have to get a new flu shot for the new mutation of the influenza virus, right? One year it's H1N1 and the next year it's H2N3. When it's a quote bad flu season, we guessed wrong, meaning we made a vaccine to the wrong variant. And so that's why it doesn't work that well. And people are like, I got the flu shot and I still got the flu. So with COVID, there are many different variants that are circulating the globe. We hear about the South African variant, the Brazilian variant, the UK variant. There actually is a Los Angeles variant nobody talks about because that's the only one we have. But that Los Angeles variant, because of our big spike, is now circling the globe. All three vaccines to date are effective against all of these variants. So even though the virus has changed and looks a little different, our body still knows how to fight it off. So far, so good. But every time it gets in somebody new and it has a chance to mutate, it may mutate in a way that our vaccine is no longer good, and now we need a booster or a second vaccine.
Got it. Okay, that's good to know. Gabriel and Marlene have the same question. They want to know just exactly how much research has been done on kids 12 to 17.
So the answer is there was a phase 3 clinical trial. This is a type of, so we have 3 phases. There's a type of vaccine trial where we test it in humans and watch them for a number of months to see how they do. So that trial was done with the Pfizer vaccine in 2,260 adolescents that followed them for a number of months. And that's where we got all of the data that told us that it's safe. What they found in that population, again, was most importantly, it's 100% effective. Nobody that got the vaccine in that study group got COVID, which is awesome.
Good.
It also told us that they do have side effects, but that side effect profile looks the same as adults, maybe a little bit better, meaning it hurts in your arm, you feel tired, you get fevers, you feel out of it for 24 hours, and then you get better. Another interesting fact that I really had to go hunting for, because this number changes every day, is how many people or how many adolescents have gotten the COVID vaccine. So remember I told you that 1.6 million people have had COVID in that age group. Well, now 4.5 million adolescents have gotten the Pfizer vaccine, which is wild because it's been like a month. So we've done a very good job of vaccinating. And when you have now a sample size of 4.5 million people, we're getting a lot more information. And there's this really cool thing called the Vaccine Adverse Effects Reporting System, where every time a patient has a reaction to the vaccine, me as a doctor, I enter it in this reporting system, send it off to the CDC, and they track all of this. And so now we've got a caseload of 4.5 million, which is much better than 2,000 that have all been vaccinated and done relatively well. Most importantly, no deaths in that entire group.
Great. I think you answered 2 questions, actually. Gabriel and Marlene also wanted to know some of the side effects. You mentioned that. And then Nara wanted to know how many kids under 17 have been vaccinated. And you just said 4.5 million. That's a big number. Like you said, especially that it's just been open for like a month. Rob wants to know how safe the vaccine, how safe are vaccinated runners running without masks?
Incredibly safe. So I'll give you a little context of why our government is being funny about this. We can't tell the difference between a vaccinated and a not vaccinated person. So when you zoom out to a population level, you have to just say, all right, everyone stay masked for now. Because I can't tell if that guy walking down the street is not masked and that guy's not masked, who's vaccinated and who's safe, right? Outside activities, which running is, especially high movement outside activities, have really always been safe. So of all, if you circle the whole globe and look at every case of COVID transmission around the globe, less than 1%, probably less than 0.1% have occurred outside. Outside activities are safe. So when we're masking, running around, really we're just sending a signal to each other that I care about you and you care about me, and we're going to do the best to take care of each other. But it's 0.1% of cases in non-vaccinated people that are transmitting that way. Once you superimpose a vaccine on top of that, you may run outside without a mask. You are incredibly well protected. Because remember, it's only 5% of vaccinated people that are going to get COVID anyways, and they're certainly not getting it outdoors.
Great. So then it's okay to run in groups and train together.
Unmasked if everyone is vaccinated. If everyone is vaccinated, very soon, I anticipate the California government will say, you may train indoors together if you were all vaccinated. That's my theory.
Let's cross our fingers for that one. Yeah. Let's see. Rob wanted to know also how much of a difference variants make, but like you mentioned, for 12 to 17, there's only Pfizer available. So we're going to skip that question and go to Marta, who said, after getting the second dose of vaccine, do you think we'll need a third dose? You already answered that as well, saying that we may need a booster, right?
Yeah.
Depending on the data that's coming in. But is there anything else you want to add?
Yeah, so if the virus stops mutating, you don't need any more doses, right? Do we need a booster when it runs, if our body forgets about COVID? Maybe. But again, some vaccines last decades, so that's great. It would really be if it mutates. So one incentive, again, I think a lot about why should young people be vaccinated? So we know, one, they want them to hospital, they won't end up dying. That's good. But there's also, if you look at a country like India or Brazil, which the virus is spreading very fast right now, the faster it spreads, the more likely it is to mutate. So say you're a young person, you say, I'd rather take my chances with the virus than with the vaccine. You being infected are one more chance for that virus to mutate and then render our vaccines worldwide ineffective. So if you aren't worried about your personal health effects, but maybe you care about your grandparents or your parents or aunts and uncles, by being vaccinated, you're reducing the risk of future mutations. So there really is a general benefit that we provide as well.
Great. That's good to hear. Jocelyn wants to know, do the vaccine symptoms affect your performance when you run?
Absolutely. So if you had told me to go run a half marathon the day after my vaccine, it would not have gone well. So I would tell all runners, plan to take 24 to 48 hours off post-vaccine. This is dose number 2. So dose number 1, don't worry about it. You'll have a sore shoulder. If you're going to do 1,000 push-ups, I don't know, maybe you'll notice. After dose number 2, plan to take 24 to 48 hours off. We tell all of our UCLA athletes this. We schedule it around big training days, just in case. Maybe you feel nothing. Great. But in the instance that you wake up like me and feel like you ran a marathon, 24 to 48 hours off. On hour 49, you're going to be good as new. So you may return to your super intense training at that point in time.
Awesome. Ruth, who's currently watching us right now, wants to know, why is it that certain people do get symptoms and others don't?
It's the robustness of your immune system responding, meaning how much of that immune reaction do you stimulate? Some of us get sick, we have no symptoms. Other people get sick and they got boogers running out. I got a 4-year-old. You got boogers everywhere and hacking up a lung, and I'll get the same thing, and it's not that bad for me. We all respond differently. Our immune systems do. And so people who have a very strong, robust immune system, so this tends to be younger, healthier people, have higher response rate to the vaccine. So if you look at a 90-year-old and a 30-year-old, you're going to see more side effects from the vaccine, side effects, meaning your body responding to it, in the 30-year-old. Old people barely have any symptoms because their immune system just isn't as strong. So it's all related to how aggressively your immune system is responding.
Got it. We have one more question in here. R and Y, who said, how do we protect children under 12?
Okay, so the highest risk group under age 12 is actually 0 to 6 months, like the less than 1 year olds. Those are the kids that can get really, really sick, end up in the hospital and die. So I worry most about the 0 to 1 year olds. The best thing we can do for them right now is protect them from the virus. So all the things that we've been doing for the past year, which is masking and distancing. You can also create herd immunity around them. I don't know if you guys remember the movie The Gladiator, where they all stand around in shields and create this protection. If every single human in your household is vaccinated, that's say 12 years and over, the likelihood of them getting sick and bringing the virus home to a really young child is almost zero, right? So you keep everyone around, you use everyone around them with their healthy immune systems with the vaccine to protect the really, really young. In ages 1 to really like second grade, so 8 or 9, because a lot of the studies were grades, they really don't see many at all complications. And this is a little bit trickier why. One is that's the age where you get all the viruses. So if anyone has siblings that are like 4, 5, 6, they're like kind of sick all the time, but then they like get over it in a day, right? Because their immune systems are super strong and just getting all the viruses and just fighting them off. They also, so a coronavirus, which SARS-CoV-2 or COVID is a type of coronavirus, is a common virus we see like in preschools and playgrounds. It's a category that their bodies are kind of used to. So they already have this little bit of immunity against it. So again, the 1 to 2 year olds all the way up to like elementary school are pretty safe too. So the group that I worry most about is really that like 7, 8, 9, 10, 11, 12, like up to our 12-year-olds, which we can now vaccinate. And we just have to do our best to be human shields for them too. All right. Their risk of complications are low. So in that 5 to 11 age group, not a ton of people getting COVID, not a ton of people getting really sick, but certainly not zero. So get vaccinated and you'll be a human shield.
There you go, guys. I do see a question in the chat, and they want to know. I'm assuming these are for SRLA races. When we're going to meet in person, and are we even going to be able to meet in person? So we're following state and local restrictions currently for all of our runs. Some of them may be virtual, some of them may be hybrid. It all depends. And I understand that running a 30K may be hard doing it on your own. So we're hoping that with our longer runs, we'll be able to meet in person. But unfortunately, right now, we just have to wait to see what the state and, local restrictions are, and LAUSD restrictions. So we'll see. There was another question that asked about booster shots, which we already talked about. And we do have a few that you may or may not be able to answer, but do you know if LAUSD or any other schools will be, or any other districts will be asking for proof of the vaccine?
Yeah, this is a question that we're looking at right now at the collegiate level too. So again, I work at UCLA, and we're trying to decide if we're going to bring students back to campus, so not just there for school, but obviously living in dorms and sharing dining halls. And it's a tricky question because we all have our civil liberties, and some people just don't want to be vaccinated. So can we mandate a vaccine to attend school? On the flip side, we kind of do. We mandate that you get your meningitis vaccine if you want to live in the dorms, right? And that you get your hepatitis B vaccine. So there is a precedent for it. It may require the vaccine to come off of what's called an EUA. So the vaccine has an emergency use authorization, meaning it was approved with this expedited fashion without these like millions of people being studied. We clearly have now studied millions and millions of people, so they just have to basically go back and do the bureaucratic paperwork. So that's all in process, and so that it will be officially FDA approved, not just emergency use approved. And once that happens, then I think there's a greater likelihood of mandating vaccine. I will also say, there's always special circumstances where people may be really afraid of being vaccinated for personal reasons. You had a terrible reaction to vaccines in the past. I'd encourage all of those people, just talk to your pediatrician. You've known them your whole life, hopefully, and they know you and your body and your health, and so you can really have those more personalized discussions with them about it. But in the spectrum of vaccines, this is one of the safest and most effective we've ever created. I keep saying we needed a home run, and we hit a home run. And so for people who have not had severe vaccine reactions, it's a pretty low risk for a really high benefit in terms of protecting you, protecting your family.
Awesome. The rest of the questions we've already touched on, except for one. Do you recommend for our students to run if they haven't been vaccinated?
So I think outdoor activities in unvaccinated people are safe. I think you need to follow the same practices we've all become too familiar with, which is social distancing. The county will likely require ongoing masking, so I can't tell you to do something contrary to the county. And this is one of the big sort of issues is the government has to make population-wide decisions, and then we as individuals have the science that we support our individual decisions. So again, transmission outdoors is incredibly rare, and I would say the risks of masking and running outweigh the benefits of masking and running in a spaced, distanced outdoor environment. So I do think it's safe for people to train outdoors together. I think if you're unvaccinated, you need to be really careful about distancing. I'll give you some interesting data. We've tracked all of our pro sports all season long. The NFL did this really interesting thing where you wore something called a Connexon. It was basically a GPS tracker that tracked how many seconds and minutes you were next to somebody else on the field, so that if an offensive lineman tested positive the next day on the Pittsburgh Steelers, I could call the Patriots and say, hey, you were next to this guy for more than 15 minutes.
Oh.
We were, of all of the athlete interactions on a field, and this is a contact sport, not even running,
right?
It was the pregame and postgame that they spent the most amount of time together because they were just catching up, just hanging out on the field talking. The same thing goes for runners. If you are moving space, I mean, you can't run within 3 feet, 6 feet of a human comfortably. It's just, we just naturally space out a couple of feet as we run.
Correct.
It's stoplights, and more importantly than the stoplight is really when you first get there and you're catching up with all your friends, and at the end of practice when you're catching up with all your friends, which is, some of the best parts of running.
Right.
So if you're not vaccinated, you got to go light on the pre and post catching up, or mask. But if you're vaccinated, the government and the science says that it's okay to be unmasked and catch up outside afterwards.
Awesome. Thank you so much. I think we're done. We're done with all the questions that were submitted. I don't see anything on our comments. I don't see anything submitted directly to SRLA on here. So if there's nothing else, we want to thank you again for joining us past 7 p.m. on a Wednesday night. We appreciate your time. We appreciate you being part of the SRLA family. We're always looking forward to any information that you have to share with us and our kids, and just the entire staff, and even here, our followers. Thank you very much, and we hope to talk to you soon.
Awesome. Thank you, guys. Appreciate all that you do.
Thank you. Have a good night. Bye, guys.
Yeah.